Hi everyone, welcome to researchmd.com. We got another great presentation. Today we're going to look at, is there a role for vitamin C in the treatment of shingles? We're going to do some literature search and come with our scientific analysis. Again, my name is Pramil. I'm a program director in internal medicine residency and the transitional residency. So let's get into our topic. In this presentation, or all our presentations based on scientific studies, evidence-based, otherwise we don't make any recommendations, okay? But please always consult your doctor before. So introduction, when you talk about varicella zoster virus, belong to human herpes virus family. You can have like the responsible for chickenpox, usually in the kids mainly, and then you got herpes zoster or shingles, reactivation of the latent infection. So epidemiology can occur in any age. 95% of the adults are seropositive or varicella, and most common in adults greater than 60 years, and report incidence of 1 to 3 per 100,000 per years, 1 to 3 per 1,000 person years in individuals less than 50 years old, and approximately 1/3 of people will contract herpes zoster in their lifetime. Huge number of people, and estimated there's like 1 million cases each year in the United States. Okay, so what are the major risk factors for this? You can have mainly when there are like a decrease in the immune system. That is like one of the, and women is more, whites more, and person with the family history of herpes zoster is also higher. Now, we did some literature search. We looked at, the role of is the vitamin C. So we found this great study, intravenous vitamin C in the treatment of shingles, results of multi-center prospective cohort study. So objective of the study to evaluate the utilization and the safety and efficacy of IV administration of vitamin C in patients with shingles, okay? So this is a when you look at the design study, this is a multi-center study. It's a cohort observational study. Data were collected before and start of vitamin C treatment. So visit 1 at baseline after a clinical phase of approximately 2 weeks, visit 2, and a follow-up observational phase of like further 12 weeks, okay? So outcome measures, they looked at the pain intensity by the scale. They used the visual analog scale called a VAS. A lot of studies use that. And presence of absence of hemorrhagic vehicle. The number of infected dermatome by herpes zoster. So 3 things they looked at in the study. One is like the pain scale based on the pain intensity, visual analog scale, and then presence or absence of hemorrhagic vesicles, and the number of zoster affected dermatomes. So what did they find? 59 patients, 92% of the showed like an improvement in the visual analog scale. Okay, a huge difference. The mean visual analog score decreased from baseline was statistically significant. P-value was like less than 0.001. So very, very significant. Okay, now they look at the number of dermatomes. In fact, almost 70% of the patients were free from herpes zoster lesions. Okay, very, very significant. The next one is they're looking at the hemorrhagic vesicles. At baseline, they have 32.8% of the patient have hemorrhagic vesicles. At the follow-up, only 2 patients. That's like 3% of hemorrhagic vesicles. Okay, very, very significant, all 3. So based on this study, we can clearly say that when you use intravenous IV administration of like vitamin C or ascorbic acid, positive effect on like the pain, when we talk about the hemorrhagic vesicles and the dermatomes affected, all 3 categories clearly shown the benefit, okay? Thank you so much for watching. We'll be back with another presentation soon. Please subscribe to our channel. Thank you.